Good morning and a very warm welcome to our first virtual Day of Remembrance at Red Cross War Memorial Children's Hospital. I welcome military dignitaries, Children's Hospital Trust donors, Children's Hospital Trust trustees and staff, our Chief Executive Officer Dr. Mukosi and members of hospital management, hospital facility board members, patients, parents and caregivers, members of the public, hospital staff and members of our Red Cross family. Welcome to you all. The annual Day of Remembrance is held to commemorate World War II South African servicemen and veterans who donated 2 days of their pay towards what was to become the Red Cross War Memorial Children's Hospital. Triggered by the plight of children affected by the horrors of war, their vision was to create a children's hospital as a living memorial in honor of their fallen comrades. Today, this world-class hospital has become a cornerstone in paediatric healthcare on the African continent and continues to provide outstanding healthcare to more than 250,000 children each year. I'm so proud to be standing here on the steps of our newly upgraded emergency center. This extensive renovation is phase 1 of the project. A child and user-friendly environment is critical to maintaining the high standard of care needed and to minimize hospitalization and ensure the child returns home to their family. Designed in partnership with our clinical team, improvements include an upgrade of the medical and trauma resuscitation areas and an increase in the number of consultation and procedure rooms. Provision has also been made for a burns treatment room, a calm room, and a safe space for children who have experienced violence. Phase 2 will commence later this year and is expected to be completed by the end of 2021. When looking towards the new year of 2020, who would have imagined that SARS-CoV-2 would rock our entire world? This devastating virus seemed to come from nowhere and has managed to entirely change the way we live our lives and how we connect with each other for work, social, and prayer purposes. We went from being able to dictate where and when we could travel to being confined in our own spaces. It seemed that nature itself was throwing us a curveball, as nature seems to have been given a breather and allowed to thrive while we were immobilized. However, it has been an ambiguous time for us all, with rules changing all the time. No alcohol, then yes to alcohol, and then no to alcohol again. The same has happened with regards to children returning to school and various other issues. All these changes indicate that no one knew just how to manage this challenging period as we learned more about the virus and how to fight it. How do we keep people safe in a country with such vast extremes of resource availability? At this hospital, we had to prepare to put processes into place to protect our staff and patients from contracting COVID-19. We started planning for COVID-19 and its potential impact on the facility before the first case even arrived in South Africa. We had to engage with all staff within the hospital regarding what the challenges are and how best to protect ourselves and our patients while maintaining our high standards of care. We reduced our elective surgeries and non-essential outpatient appointments to free up resources to assist with potential bottlenecks and anticipated challenges. We also embraced and promoted innovation at the facility, and new, more streamlined methods have been developed by staff to reduce the risk of contracting COVID-19 and to ensure that we still provide an excellent service to our patients. This COVID experience has certainly taught us to never take anything for granted. The simple things in life, like being able to comfort someone with a hug, celebrate a birthday, or indeed mourn the loss of a loved one. But along with all the negatives, there have been so many positives. It has been a time for many to rise up in their communities and really reach out to give a helping hand. The support that we have received from individuals, companies, and communities has been overwhelming, with donations of masks and other personal protective wear to food parcels and clothes for patients, we have been able to offer our staff adequate protection and offer families much needed relief. We are very thankful to all these donors who have supported us through COVID and those who have supported various projects over the years. After 64 years, the hospital continues to be a place of hope and healing for children and their families. Our sincere appreciation goes to the World War II servicemen and veterans who had the wisdom and vision to set this in motion. The legacy of giving from the hospital's founding World War II heroes lives on through the fundraising of the Children's Hospital Trust, which relies on the benevolence of donors to ensure that the Red Cross War Memorial Children's Hospital remains on par with international standards of healthcare. 100% of all donations to the Trust go directly to the benefit of children in need of highly complex clinical interventions. Through the kindness of donors who support this government-funded institution, the hospital has been able to grow from strength to strength. Without the contribution of the community who have given and continue to give, the hospital would not be able to continue striding forward to improve the lives of children. Thank you.
Good day and a warm welcome to all of you who are joining us at this, our annual Day of Remembrance. And we do this every year, but this year we're doing it differently. Of course, you know why we're doing it differently in a virtual platform. It means we are living in an unprecedented moment in history with this coronavirus pandemic. And so in this way, my speech today, I want to focus mainly at encouraging you, just to show you that despite whatever happens, something good can always come out of difficult or tragic moments. Even when you think of this hospital, we know that it came as a result of something that could have been seen as something very bad, a war, a world war, where children had suffered the loss of their parents, the loss of their fathers. But then within that context, there were people who decided to say we want to leave a living memorial so that the children who lost parents could now also benefit from this living memorial of a hospital. So today, we have the Red Cross War Memorial Children's Hospital, which came as an aftermath of the Second World War. So what a contrast. You've got the war this side, now you've got a living memorial of a hospital. So that's why I'm saying, for me, I just want to say to you, out of something tragic, something good can come out of something tragic. So look at this. I realize that we are indebted to the World War II veterans who realized that they have to leave a legacy, something that could stand as a living memorial for those children. And that's why today we've got the Red Cross War Memorial Children's Hospital. So the Red Cross War Memorial Children's Hospital is a premier institution delivering specialist tertiary, quaternary, and quaternary health care to our children, both in South Africa and even beyond our borders. So we are also a specialist training hospital for child health services in terms of the medical training and also the pediatric surgical training. And you can also see the other event that took place in 1994. There was again another crisis that also resulted in something good. So with all the challenges, financial challenges in 1994, this hospital was at the verge of being closed down. But then out of that, some people who had a vision, who had a passion to take on this legacy said, we have to stand up, we have to do something and make a change. So that's how the Children's Hospital Trust was born. Because then those people realized we could raise funds, we can actually join in and join with the government and make sure that this living memorial, the Red Cross War Memorial Children's Hospital, continues to live on. I'm aware that some of the difficult moments, usually when you face challenges, you don't even think of something good out of those challenges. I'm actually reminded of one incident for those of you who know Bible history. There was this young man called Joseph. He was rejected by his brothers and he was even sold to a foreign land as if things should go bad with him in his life. That's what they intended. But out of that, even when he reached in Egypt, he was accused falsely, taken to prison, But at the end, he became the prime minister of that land. So it means anything tragic, you can turn that out, and then it end up being something beneficial. So that's why I just want to encourage you that even when we are going through this COVID-19 pandemic, there are also a lot of lessons that we've learned. We've also seen actually how all of us together, we can join hands and make a difference in people's lives. So that's why I just want to encourage all of you as we look forward to say if we join hands, any crisis moment can be something good. That's why we are also appealing to all our donors and all the people who have been supporting us for years to continue to support us so that we can keep on making a difference in the lives of so many people. So the spirit of generosity, I've seen actually throughout our hospital, even during this COVID pandemic time, the support that we got from our communities through the Children's Hospital Trust. Many people were even stepping forth and asking us, do we need anything that they can help us with? So it was so much encouraging to find that people are so generous and they want to join hands with us to do something good out of this. So I'm saying even in this coronavirus pandemic, something good can come out of this. Look at opportunities that you may get out of this. Look at how you can do things differently. Our services have been transformed completely and we are doing things differently now. Things that we could have only achieved maybe many, many years from now, we have already now started achieving some of those. So this should serve as encouragement for all of us. But I also just want to give a special thanks to all our staff who are so committed to continue to deliver quality health care to our communities. And indeed, we are known here at this hospital as a premier institution because of people like them. We've got so many people who have been working here for so many, many years. And I'm also thankful to all our partners, be it the Children's Hospital Trust, the Hospital Facility Board, and the University of Cape Town as our key partner in delivering the quality health service. Thank you very much.
No little child will ever starve or suffer needless pain. The aged will live their twilight years in sunshine, not in rain. The cripple will help to walk, the blind will help to see the wonders of God's handiwork in all His majesty, to feed and to clothe and to build again, where hope should shattered be. This is the crowning moth ideal to help humanity. When you go home, tell them of us, and to say for your tomorrow we gave our today. Their gift was great, but you must give a greater, to complete the plan. They died, now you must nobly live, to make brother unto man. I shall pass through this world but once, and any good therefore that I can do, or any kindness that I can show my fellow man, let me do it now. Let me not defer it or neglect it, for I shall not pass through this way again. Moth salute. They shall not grow old as we are left to grow old. Age shall not weary them, nor the years condemn. At the going down of the sun, and in the morning, we will remember them. Drop salute.
Così si caleli Africa, malu pagani su pondolwayo, Israel mitanda zoyetu, così si calela tina lusapolwayo, Murena buluka se chabasa Yesu, ufedi se dintwa le matwenye o se buluke si chabasa Yesu si chabasa. South Africa, South Africa. Uit blauw van onze hemel, uit die diepte van ons zee, oor ons eeuwige gebergtes, waar die kranse antwoord geeft. Sounds a call to come together, and united we shall stand. Let us live and strive for freedom in South Africa, our land.
On behalf of the Board of Trustees and everyone at the Children's Hospital Trust, we would like to express our deep appreciation for the incredible support from our donors, hospital management, service providers, and volunteers. The Children's Hospital Trust, as a public benefit organization, has been assisting the hospital with its priority needs for the past 26 years, with 100% of all donations going directly to these specific projects and programs. Legacies are one of the Trust's most critical sources of long-term funding. They enable us to plan for the hospital's future needs and ensure that the legacy of the hospital is passed on to future generations. Sickness in children is always an emotive issue, not only for the children themselves, who can't understand illness, but for the parents and families too. Each year, the hospital sees around 250,000 children come through its doors. For the medical staff, it is a demanding, relentless, and sadly escalating battle. Yet, despite the workload, there is absolute focus on child health. The hospital is resourced with passionate and committed staff who do whatever they can to maintain hope and return sick children to the joys of a normal childhood. We never lose sight of the fact that it will not be possible to do all these good deeds without the amazing support we receive from so many people and organizations. Thank you for joining us today on this memorable occasion. And once again, thank you for your support.